true. Love can take you anywhere. For Nardine, she quit college and she started to work in Valentine's shop.
And here comes the moment we've all been waiting for. When he proposed and she said yes, till they decided to bond their lives together forever. Ladies and gentlemen, let me introduce you to the magical hormone of love, oxytocin, the superhero of hormones. We hear about oxytocin nowadays everywhere. Newspapers, magazines, and Twitter. We even now have oxytocin injections. When Walt Disney first created Mickey and Minnie as the first symbols of love, trust me, it was for a reason. Oxytocin was first discovered and re-injected in rats, and it had controversial effects in males and females rats. But when it comes to humans, we face stressors every day. House training the puppies, road traffic accidents, educating our kids, cortisol is released, increasing our heart rate, blood pressure, having us shallow breathing. But thanks to the magical hormone oxytocin, everything will be back to normal and our success lives can be resumed. So how could you increase your level of oxytocin? First of all, chocolates. Chocolates do not only increase your level of oxytocin in your bodies, but they also act on the same love receptors. Adding to this, coffee, of course. Thinking of a perfect Valentine's Day gift, chocolate, coffee, and hugging. Yes, hugging is not only a good gift, it's also a perfect medicine. Studies have proven that hugging would increase. 4 times of hugging would increase the survival, 8 times of hugging would increase the maintenance, and 12 times would increase the growth and bonding in your relationship.
Well, Nardine eventually got married, and her mom took her to the Obs and Gyno doctor to explain to her what does it mean having babies.
Tell her how bad it is.
The bond toward the partners becomes a dream for every woman to carry a little copy of her and give it love and care.
And this love starts since being inside her uterus.
The bond of a mom towards her baby starts even from the early kicks, probably from the 18th to the 25th week of gestation.
And this bond increased by seeing the baby by the ultrasound. Look, the baby is sitting alone in a dark place. Why not trying to amuse him by talking to him or make him listen to music?
What? Can he hear this?
Yes. The 3D and 4D ultrasound proved that the baby could feel and respond to his mother's voice, heartbeats, or some types of music.
Oh, this baby seems he didn't like the music.
This one is saying hi.
This one is smiling.
This one seems to be thinking. Maybe one day he will be a philosopher.
Oh, this one is cute.
And here comes the moment the mother has been waiting for with every single beat of her heart, the delivery. This huge event is controlled by 4 hormones. The maestro of love, oxytocin, helped by endorphin, melatonin, and adrenaline. But adrenaline blocks oxytocin action. So we advise mothers, please don't stress and relax. When it comes to time of delivery, it's proved that the mothers who deliver vaginally are more boldly attached to their babies than those who deliver by CS. And now, the baby has just arrived. The first hour after the delivery is called the golden hour. Holding the baby and making skin-to-skin contact during this hour creates a stronger bond, make the mother calm, help in placenta expulsion, and decrease postpartum hemorrhage. So, please help your wife to produce more oxytocin by being supportive and touch her in a nice way.
So now we have got the baby. Mission accomplished? Not yet. Love has to proceed in a new way. The first 2 years in a baby's life are the most important ever, as babies develop their emotional behavior which affects later on their sexual behavior. This was proved by Harvey's Harvard research on a group of monkeys. They were isolated from proper contact and touch. Later on, they were found to be underdeveloped and failed to engage in proper sexual behavior. Oxytocin is still our superhero in this phase. It starts even when the mom thinks about her baby. Oxytocin level starts to rise when the mom hears her baby crying, reaches the maximum when she holds her baby, and variations goes up and down with suckling. Oxytocin was proved that amplify men's early memories about their mothers. So moms, think about it. Even when you breastfeed your children, when you spread them love and care, you are giving love to the coming generations and maybe to the whole world.
So love is not only the love of your partner,
Not only the love of our parents,
Not only the love of our sons and daughters,
Not only the love we have for sisters and friends.
Even when we pray, we love.
Love is our identity, our journey. With love we start, and with love we never end. Thank you.
Thank you for the group presenting love from scientific point of view. It was very positive and it gives us insight. And now Dr. Nadine will present the 8th presentation. Hi.
The 8th presentation for today will be natural methods of pain relief during labor, and it will be presented by Hassan, Reem, Hazem, Manal, Islam, and Khalid.
Yes.
Well, congratulations, Mrs. Reem. You're pregnant.
Oh, thank you.
What's wrong with you? You seem disturbed.
I'm afraid of the pain of normal delivery, and they don't want to undergo analgesics.
So not normal delivery, no analgesics, so no C-section. I've got a solution. We can deliver the baby, say, out of your nostrils, go home.
Thank you. Hazem, I'm pregnant.
Wow, I'm gonna be a father. Oh, you don't seem to be happy. You don't want to be pregnant? You don't want to have a baby?
There is a problem.
Oh, what's it?
I told the doctor, I told him, I wanted a way to decrease the pain other than analgesia. He wasn't helpful at all.
Okay, don't even trip. Google will find us solution.
Welcome to Google.
There are many non-pharmacological methods to relieve pain during labor. Just search and you will find the solution for your problem.
There are 3 main methods to relieve pain: gait control theory, physiopsychological method, and physical activity.
The gait control theory is currently the basis for many of the available pain relief methods. It depends on the activation of non-nociceptive fibers which transmit signals other than pain, overlaying the pain signals and masking the pain sensations. These methods include intradermal water block, TENS, acupuncture, heat packs, applying pressure, and massage.
Oh, check that intradermal water block. I guess that's suitable.
What a relief. I thought there weren't any methods. That's a problem.
Firstly, the woman's back is cleansed. Then 0.10 to 0.15 cc's of sterile water is injected intradermally into 4 places on the woman's sacrum. The sensation masking pain in this method is burning sensation that lasts shortly, about 30 to 90 seconds. This method is specifically beneficial for women already suffering from back pain.
Look, transcutaneous electrical nerve stimulation.
ridiculous.
Oh, what a creative method.
TENS is a transmission of low voltage electrical impulses from a handheld battery power generator to the skin by surface electrodes. The woman can control the intensity of the current. It masks pain by a prickling sensation. It also reduces the duration of the first stage of labor and decreases the amount of analgesics needed.
Acupuncture, a labor?
Yeah. Did this hurt you?
No.
Okay, supposedly 100 of these are what's going to be relieving your pain.
Acupuncture is the insertion of fine needles along specific points in the body, followed by heating, applying pressure, or even electrical stimulation. Acupuncture is proved to increase enkephalin, serotonin, and endorphins, which increase the sense of well-being as well as endogenous analgesia. According to a 2007 randomized controlled trial, the acupuncture group had a significantly lower active phase duration, pain experience, and the need for exogenous oxytocin administration during labor.
Heat packs, it's an extremely simple solution.
What good will it do?
Warm moist packs are applied to the perineum late in the second stage of labor. It will increase vascularity and metabolism at the area of application, and it will decrease muscle tension.
All right, that's about gate control theory methods. What about physiopsychological methods?
Okay, you will give birth by hypnosis. I made a decision. Okay. Dr. Khashaba will relieve your pain.
Do you think you are funny?
Yeah, I do.
When a woman is in labor, stress hormones are released in her body. Stress hormone causes contraction of muscles, and logically, contracted muscles delay the delivery of the baby. The anterior cingulate gyrus has been demonstrated to be one of the sites in the brain affected by hypnotic modulation. The suppression of the neural activity between the sensory cortex and the amygdala limbic system appear to inhibit the emotional interpretation of sensations such as pain.
Aromatherapy? How?
Okay. Give birth. Where is my baby now?
Aromatherapy is a complementary therapy using essential oils. These oils are extracted from plants containing highly concentrated therapeutic chemicals. Examples of these oils are black pepper oil as well as lavender oil. Aromatherapy has a transient effect in reducing anxiety during labor. However, you will have to be careful about which oils you use because some may cause miscarriage or even other complications. Also take care if you're asthmatic or suffering from hay fever.
What about these physical methods?
Okay. Well, here is the physical method. Water birth. Oh, you will give birth to a tiny... Oh, you will give birth to a tiny, cute, little baby diver, you know? Seems pleasant.
Water birth means at least part of your labor, delivery, or both happen while you are in a birth pool filled with warm water. It can take place in a hospital, birth center, or at home. A doctor, midwife, or nurse can help you throughout it. Lying in warm water gives sense of relaxation, pain relief, and ease of movement. Complications are rare if good practice guidelines are followed in relation to infection control and management of cord rupture.
Breathing methods seems pleasant.
Okay, this method is subdivided into two main practices, the Bradley method and the Lamaze method.
Bradley method. It is the use of nutrition, relaxation, and natural breathing as a pain management techniques, along with active participation of the husband as a coach. Its distinctive feature is the presence of a birth coach that provides physical, emotional, and informational support to the mother in labor. The Bradley method is concerned with relaxation techniques and natural pain reduction during labor and birth.
The Lamaze.
Oh, freaking internet connection. Oh, refresh.
The Lamaze method depends on both the psychological and physical preparation of the mother, promoting for both a drug and pain-free delivery. It was first used by the French obstetrician Dr. Fernand Lamaze in 1957. According to a randomized controlled trial, The Lamaze group had lower beta-endorphin immunoreactivity, indicating that they had less stress, fear, and tension during labor. The main point against this method is that it takes some time to prepare, minimum from 4 to 6 weeks.
Okay, there are two other methods, but they are going to sound silly.
Well, what are they?
Okay, the first is changing position during labor.
Studies have shown that changing position throughout labor can facilitate positive outcomes, including decreased pain, decreased length of labor, good maternal fetal circulation, and decreased perineal trauma.
Okay, what is the second?
It's birth ball, you know.
Birth ball? That sounds like a game.
Birth balls are similar to gym balls. You can use birth balls to get into comfortable positions during pregnancy or labor to help reduce pain of contractions, or even after your baby is born. According to a randomized controlled trial in Taiwan, results were mothers have shorter first stage of labor, less epidural analgesia, and fewer cesarean deliveries. Some midwives recommend the combination of birth balls and tents to help women cope at home in early labor.
Okay, we found many methods for relieving pain. Why didn't my doctor tell me about them?
Ladies and gentlemen, there are actually two schools of thought about how women might cope with labor. The first believes that in the 21st century, there is no need at all for any woman to suffer unnecessarily through labor, and that analgesics should be administered to every single laboring woman. The second, though, believes in the opposite, that no drugs are better, and that's for two reasons. The first reason is that these natural methods of pain relief have proved to have a positive effect on the woman's postnatal psychological state. This was even proved by a systematic review in 2007 measuring the woman's postnatal satisfaction by the experience. Women receiving no drugs at all were more satisfied. The second reason is that epidural, while actually a great method, but increases the incidence of instrumental delivery, which carries uncalled for hazards for the baby, to say the least, and that analgesics should only be administered to women who need it. The problem is that most women think they're between a rock and a hard place. It's either feel the pain or undergo anesthesia. Why? Because they do not know any better, and the caregiver hasn't told them. The most important message here is that every single woman should know all the options available for her to make sure she chooses the most one suitable for her, both physically and psychologically. Thank you.
Actually, the ninth presentation will be a surprise about the topic. Even me, I was very surprised from it. It will be about gynaefiction, presented by Mishu, Nashat, Inji, Salma.
اديني وين
Okay, camera, light, action!
Kazım!
wrong?
Cousin, I'm dying. I'm dying of pain.
Calm down, baby.
I think I'm having the baby, cousin.
Having the baby here?
Yeah, here, cousin.
In the space?
Cousin, I'm dying.
Come with me, come.
It's all your fault, cousin.
My fault?
Cut! Okay, molto buona, people. Gynefiction will be the movie of the year. Okay, wait for a second. I think you don't understand anything, so let me take you back to the beginning of the story. Mr. Narrator? 3, 2, 1, action!
Once upon a time, in a galaxy far, far away, there was a girl, Awatif, with a lifelong dream of becoming an astronaut. And while on that long journey, she stumbled upon the man of her dreams. Qasim kept her spirits up all throughout the difficulties of her journey, until one day, her best friend, Masha'ir, who shared the same passion for space travel, came to her with news that NASA has a few opening spots for female astronauts. Awatif knew straight away that her dream job and spending the rest of her life with Qasim could not coexist. She had a serious decision to make, but luckily for her, it was an easy one.
Cut! Fermarlo, stop it, Mr. Narrator. Too much drama. Okay, saying it again. The main purpose of this scene is to state that pregnancy on Earth is not a disqualifying condition. However, future examination and selection trainings cannot be completed during pregnancy. But on the space shuttle, pregnancy is disqualifying due to ectopic, possible side effects that may occur in any pregnancy, like ectopic pregnancy, abortion, preterm labor, in addition to radiation, toxins, and the effect of microgravity on embryogenesis. Is it clear, Mr. Narrator?
Okay, but we should...
Shut up, Seko! Let's go to the next scene. 3, 2, 1, action!
After undergoing all the requested tests and procedures, Awatif received a telegram from NASA stating her acceptance into the program.
Dear Ms. Awatif, congratulations. We are writing to inform you that you have met all admission requirements and were selected to participate in astronaut training. You have passed all medical examinations, including your full gynecological and obstetrical examinations, your pelvic and abdominal sonography, pap smear, and mammography were all negative for disqualifying conditions.
Yes, finally.
NASA disqualifies candidates with conditions that carry a high risk to complicate, requiring emergency interventions that aren't available or accessible in space. Some candidates may have to undergo biopsies or surgical procedures to rule out disqualifying pathologies in conditions as ovarian or breast masses. And due to the risks of radiation exposure on carcinogenesis, all gynecological malignancies are considered disqualifying except for successfully treated cervical carcinoma in situ. And due to the tough selection process and strict examination, not one single gynecological or obstetrical emergency has occurred in space.
Cut, grande, Mr. Narrator. Very good, very good. Okay, people, let's go to the next scene. Action!
Although finally starting to take the first steps of her journey, Awatif just couldn't get over the fact that she left behind a piece of her back on her home planet. Or did she?
Qasim, it's really you. What?
Yeah,
what are you doing here? Oh, Qasim.
I couldn't imagine my life not being with you during this whole journey.
I missed you so much, Qasim.
At that moment, Awatif was overwhelmed with feelings of joy, anger, and confusion. But it didn't take long for her to realize things up there could not get any better. And they wandered off as she gave him a quick tour around the space station.
Fly me to the moon, let me play among the stars.
I'm pregnant.
What?
Awatif panicked and rushed to find Masha'ir on the other side of the space station.
Masha'ir, I'm looking for you everywhere. Where have you been?
Calm down. What happened? Calm down.
I think I'm pregnant.
You think you're what? Pregnant? How could this happen? We take OCPs. Oh my God, I forgot to take mine today.
Hey, just keep calm, Masha'ir. The pills are only prescribed to stop menses and also to treat some diseases if we have any, like menorrhagia, dysmenorrhea, and endometriosis. Also, the scientists discovered that the pills decrease pain, swelling, and the increased rate of bone resorption that we encounter up here. Hey, don't you remember the lecture we took back in Earth?
Actually, I didn't attend this lecture.
Oh, missing lectures.
Let me ask you about the main thing. What about menstruation in outer space?
Okay, as I remember, the doctor said that menstrual flow and hygiene measures are just like back in Earth. But the only problem of menstruation up here is the contribution of the retrograde flow due to the microgravity in producing endometriosis. So just try to keep track with your pills again.
Okay, that's fine, thank you.
But you're missing the main point. I'm telling you, I'm pregnant here, alone. I really don't know what to do.
Okay, calm down. I think we should contact the doctor back in base. He'll have a better idea what to do.
It's a great idea.
Let's go.
We need doctors.
Awatif and Mashar rushed to contact their doctor back at headquarters. And after several trials, they finally got through to him.
Doctor, hello, could you hear me?
Hi, how is everything going up there? I can hear you.
Yeah, everything is fine, doctor, but I want to tell you something. You probably won't believe it. I think I'm pregnant.
Pregnant? Like pregnant? Sure?
Yeah, pregnant, yeah, I'm pretty sure. But why are you so shocked? Is it really that bad?
No, nothing like that. But as you know, this is the first time for a human to conceive in outer space. And all the studies were done on mammalians, mostly on rats.
Rats? Only rats? But I'm a human, what about me? Anyway, what are the results of these tests? Maybe they will be helpful.
There were rats, but the results were quite promising, as the main concern were about the microgravity and the radiation environment. As I remember, the fertilization was normally okay, and the microgravity obtaining like 75 healthy offspring, with slower and significant development than the others, and the fertilization stage still under development studies.
But sorry, doctor, I think I have already passed these two phases. What about me and the baby now? What are you gonna do?
Yes, about your baby, another studies were done on rats from day 11 to 21 of gestation, and it was on NASA Space Shuttle. Fortunately, there were no any effect on the fetus, and about you,
Oh, thank God, then the babies will be okay, doctor?
Yeah.
Okay, what about your baby?
Regarding you, as I remember, the studies were shown also that uterus and especially the myometrial part were reduced normally, and compared with the control group back on Earth.
That's much relieving, doctor. Thank you. But what about the delivery? Could it be here? And what will it be, vaginally or what?
We will take our chances in vaginal delivery, as the rats were allowed also to deliver vaginally after a full term of gestation.
Thank you, doctor. Thank you for reassuring me. Really, thank you.
You are welcome, and please follow up with me whenever you can, and remember that.
Perfecto, people, grande. And we'll know how the story ended. Okay, people, let's go.
Our story has not come true yet, but one day our fiction will become reality. As mankind once